Good morning, everyone. This is a very interesting thing. Yesterday I tweeted, ask your friends how many people they think have died since the beginning of September from COVID in the city of Toronto. Okay? Just ask them. Find out what they think, and then tell them that it's none. Zero. Zero. We're the 22nd of September, and nobody's died of COVID since the end of August. And at the end of August, very few people had been dying of COVID through August. Really? Here's Ezra Levent, and he says, not a single person has died from the virus in Toronto in September. The last death was August 28th, almost a month ago, and that was the first in weeks. There are a grand total of 4 people in the whole city on a respirator. It's over. It's over. It really is. Here's the data. City of Toronto COVID-19 status of cases in Toronto. Okay, you can hover over this. This is recovered cases, and down here you can hover, and this is deaths. Okay, July 1st we were at 1,159 deaths, or this is July 2nd. And as you go through July, you can see the deaths increasing, and then kind of stall out. Right, 1,175 on July 17 is. July 18th, is where we start to see a really big slowdown in deaths. And then you move forward and there's not another death until the 29th. And then again, not another death until August 16th, I believe that is. And then not another death until August 28th. And then not another death. Not another death. So that seems, like an emergency. Like we should shut everything down right away, right? Here's Mr. Ford and Miss Elliott saying, Ford says Ontario COVID-19 second wave strategy to be outlined Tuesday. What's this? What strategy? What strategy? Like nobody's dying. Nobody's dying, right? And the deaths that they were, the deaths that they were having, sometimes they weren't even COVID-19 deaths. If you died with COVID-19 in Toronto, you were attributed as a COVID-19 death. And that's, I could show you that tweet. Let me know if you want to see that tweet. I'll add it to the comments, but I didn't add that tweet. You can Google search it. It comes up on the top until they scrub it, I suppose. Okay, so what's the plan? What's the plan for the second wave? Testing, more testing. They're ramping up testing. I'm not going to go through this whole article. I'm just going to tell you that that's what they're doing. It says the province also said it has processed 31,753 tests over the previous day, and it aims to complete 50,000 daily tests over the next few weeks. Elliott said that some elements of the new fall preparedness plan are already being implemented, including the ramp up in testing. The second wave will be more complicated to respond to because of the flu season and the need to address the province's surgery backlog, she added. We have planned for the worst and we're ready for it. Elliott says the plan will involve hundreds of millions in spending, which has required the government to complete due diligence on the strategy. So adding testing isn't helpful when the testing is, 1, expensive, and 2, yields false positive results, because that makes the test useless. Useless. This is from the BBC. I believe it's from the BBC. If not, this is an interview with an Oxford professor, and he makes his case. This is shared by Your Ontario Doctors, and they quote it. It says, when you are picking up asymptomatic people, you have no idea if you have an active SARS-CoV-2 infection or if they had it 2 months ago, because PCR tests being deployed in a sort of ragbag way with PCR cycle thresholds above 25. And this is something that I talked about yesterday, but I think it's important here. Here's this whole 2 minutes. It's important. Here we go.
Come back to another really important point that we did write an article. In fact, the first article we wrote about this was in The Spectator, and it was in the New York Times on the weekend as well. And we're just about to put out another update of our review. When you do a PCR test, you basically amplify the amount of RNA, you put it into a DNA copy, and then you exponentially double that amount of DNA. And that's called the cycle threshold. And the more times you do that, the less virus you start out with. And this is important because you can basically pick up a single copy of RNA in an individual. There is a complete difference between you being infectious, which is about 7 days from the onset of symptoms, to about at day 8, you cannot find infectious people, apart from the few people who end up on ITU who are worsening. We have found RNA shedding in evidence for 78 days because the RNA is only 20 base pairs long and it takes much longer for you to degrade the RNA. So when you're picking up asymptomatic people, You have no idea if they have active infection or did they have it 2 months ago, because you intermittently shed this RNA, and it's the same for all viruses. Now you can put in a threshold level which says you are infectious, which is a cycle threshold of about 25. And if you do that, you can pick up the people who are infectious. But the way we're deploying the test at the moment is in a sort of ragbag way that says, whatever amount of RNA you've got on board, you are positive. And we are going to see this move forward. And we've wrote this about 2 or 3 times in the Spectator and kept moving forward the discussion. But it's now on the radar because there are 25 studies that have now looked at this, and 10 have come in the last 3 weeks. So this idea is becoming more important. Come back.
So it's being talked about, it's being discussed, and yeah, I think that this is an important thing to point out. If we're having testing and the testing is not reliable, well, what use is it? It is no use, right? What use is it? 0. So how much is this deeply flawed PCR testing frenzy of asymptomatic people costing Ontario taxpayers? How much does each test cost? Who is lobbying for and profiting from this counterproductive and harmful endeavor? Why is Ontario government abandoning science? And this is in response to Christine Elliott. While our best defense continues to be our everyday actions and stop the spread of COVID-19, we require the necessary resources to prepare for any scenario, including expanding testing capacity, launching more testing locations, and adding more case and contact management resources. So they're opening Shoppers Drug Marts and pharmacies to test people, asymptomatic people, and that is not the right move. And why is it not the right move? Okay, I'm going to show this now. I think this is Dr. Yaf again saying, in testing populations with low COVID-19, you get 50% false positives. And these are for all the reasons that this guy was explaining the false positives, right? This person here was explaining the false positives. So here she is confirming 50% at least false positives. The higher the PCR cycle, the higher likelihood. The more above 25 you are, the more likely it is a false positive. Okay, so here we go.
You know, I think a lot of people think that testing is going to really solve the whole problem, and it isn't. It's one component of a response. If you test somebody today, you only know if they're infected today. And in fact, if you're testing in a population that doesn't have very much COVID, you'll get false positives almost half the time. That is, the person actually doesn't have COVID, they have something else, they may have nothing. So it will just complicate the picture.
Complicating the picture is not exactly what you want to do, right? Adding false positives, adding fake positive test results, having nobody in the ICUs and saying, we've got to lock down, having no deaths since the middle of August or the end of August. Yeah, it's an emergency, everybody. Just wait till we see what John Tory talks about. Here's the National Post saying, test reset. This is out of Alberta. Why experts say you shouldn't show up for COVID testing if you're asymptomatic, if you don't have symptoms, right? If you're not sick, don't go get tested for this. Canada should reel in testing people with no known symptoms and no known contacts. The focus should be on diagnosing people with symptoms quickly. In the first wave of COVID-19, the goal of testing was to cast the net wide to find hidden cases and get a feel, Queen's University Dr. Gerald Evans says, for how broadly based the infection was in our society. Experts pushed provinces like Ontario to increase testing from an insignificant 5,000 a day to get a better picture of the virus and how many susceptibles remained among us. Alberta and Ontario soon after opened up testing to anyone who would like to be tested, even if they had no symptoms or no known contacts to a confirmed case. The same people now straining overloaded pandemic testing systems. Alberta announced Thursday it's hitting the reset button, temporarily halting broad asymptomatic testing in anticipation of a fall surge in demand for tests as schools reopen and cold and flu viruses make their annual arrival. Since May 29th, Alberta has completed some 233,000 tests on people showing no symptoms, with only 0.07% returning positive, about 163 cases. I'll say that again because sometimes people are just kind of half listening. 233,000 tests, only 163 cases. That's 0.7%. Okay, 0.07%. That is just unbelievably low. Okay. Alberta tested an average of 1,300 13,625 people a day over the past 7 days, nearly 6 times the 2,380 people tested per day in March and April. The cost per test, about $74. Labs across Canada tested an average of 47,111 people daily over the past week, with 1.4% testing positive. 47,000 tests, 1.4%. Okay. Ontario, meanwhile, will soon be getting a couple thousand new COVID-19 testing centers at pharmacies for those without symptoms, Premier Doug Ford announced this week. The idea is to ease congestion at COVID assessment sites. The province is going to ramp up testing like you've never seen before, Ford pledged. Ontario has increased its capacity since the early days from 5,000 to 25,000 to 30,000 tests per day, with plans to move up to 50,000 tests per day and beyond. But Evans and other experts say, if anything, Ontario should reel in testing people with no known symptoms and no known contacts. The focus should be on diagnosing people with symptoms quickly. Evans said Evans and others are less interested in asymptomatic, no-risk contact people because they provide less information at this point in the pandemic. And we know we're going to have lots of people now with common cold symptoms who are going to present for testing, and we need to be able to find the ones that are real COVID so we can control them with contact tracing and isolation. Yeah. And again, 50% false positive, right? 50% false positive. I don't see how, even if you went for the test, if you were asymptomatic and got a positive, or if you had cold symptoms, went for the test and they said, yep, you've got COVID. What are they going to do for you? They're not going to give HCQ. They're not going to give hydroxychloroquine and zinc. What are they going to do for you? They're going to send you home and say, fingers crossed, come back if you have trouble breathing and we'll put you on a ventilator. Like, that's as far as I know what the protocols are now. I could be wrong. They may have updated them, and I hope they have. But as far as I am understanding things, as far as the Twitter discussions that I've seen, Ontario doctors are not being encouraged to prescribe HCQ. So what are they going to do for you? You have COVID-19 confirmed by this handy test here, and we're going to send you home. Like, okay, so better to just not get tested, and if things get dire, go to the emergency room, right? But otherwise, like, why get tested? What are they going to do? Please do let me know. If they're going to do something for you, let me know in the comments. But usually with a virus, they're like, I was watching Doc Martin, and he says, drink a lot of fluids, and if it doesn't get better in a couple of days, give me a call. What are they going to do? It's a virus. Antibiotics kill the bacteria that are being problematic, right? Like they help your immune system destroy the problem. But antivirals are very different. You don't pop a pill for viruses. You just don't. Okay, back to this. Mayor John Tory promises to bring the hammer down as COVID-19 infections rise in Toronto. This is rwindsor.ca. Have you ever heard of this? Like, oh, yes, King Tory, please bring are you going to increase our Rogers bills as well? He owns Rogers. He's one of the main shareholders. He's on the Rogers Control Trust. I did a video series about it years ago. Okay, city officials are promising stronger enforcement of regulations and bylaws aimed at stopping the spread of COVID-19 amid troubling and persistent increase in the number of cases. It's time to get much tougher, to bring the hammer down, as it were, when it comes to enforcement, said Mayor John Tory, speaking at a COVID-19 news conference at City Hall. Tory said the city is so far focused on education and warnings, but the time has come to mete out consequences to scofflaws. I think most people acknowledge we have arrived at that time, Tory added. There's a lot at stake. It's time to comply. Ontario reported an additional 425 new cases on Monday, including 175 in Toronto, well above the average seen this summer of 15 a day in the city. Toronto's medical officer of health, Dr. Eileen Davila, said there were 453 new infections over the weekend in Toronto. I love how they just focus on infections and not on any of the other numbers, because the other numbers show that this is done. This is absolutely done. Period. Okay, so here is The Spectator. The Spectator is a UK publication. But I want to show you that this is worldwide. The things that are happening here, the people are ignoring, the people in charge, the people in leadership positions are ignoring these inconvenient truths in order to continue their draconian lockdowns, and they're using faulty data or faulty projections to back up their reasoning. Here's the Spectator article. It says 5 questions for Chris Whitney and Patrick Vallance. So here it is. The Chief Medical Officer, Professor Chris Whitney, and Chief Science advisor, Sir Patrick Vallance, made a statement this morning on the latest data surrounding COVID-19, laying the groundwork for new restrictions that the government is expected to announce tomorrow. It wasn't a press conference with questions, so they could not be challenged on what they presented. But there were plenty of questions to ask. Here are 5. Why present only one COVID scenario with extreme assumption? Sir Patrick presented a graph showing a frightening exponential rise in cases to 49,000 a day by mid-October, if cases continue to double every 7 days. He emphasized that it wasn't a prediction, yet only presented one scenario. The idea that cases are doubling every 7 days is based on data from a very brief period in late August and early September. But in France and Spain, which are being watched closely under the assumption that the UK is following the same COVID-19 trajectories, cases took 3 weeks to double. Moreover, the graphs presented to us show that cases are no longer rising at an exponential rate. In fact, the rise is starting to level off. If the UK is following France and Spain, this does not support a scenario of COVID-19 infections doubling every 7 days. Why didn't he also show us graphs with this scenario that we follow either Spain or France, right? So this is the graph they showed, and this is this following Spain, following France, following Spain. So interesting. 2, death scenario is not like it was in March. Is this being factored in? Questions that I also have. The graphs that they showed of rising cases and fatalities in France and Spain were framed to illustrate what appeared to be a dramatic rise in deaths, responding to a dramatic rise in cases. What they didn't show, because the graphs only started in July, was that the second wave of COVID-19 in Spain and France, and this applies to many other countries too, deaths are not rising by anything like the same proportion they were in the first wave back in the spring. In France, for example, the recorded daily new cases are higher now than in the spring, 13,498. New cases were recorded on September 19th, compared with a peak of 7,578 on 31 March. Looking at these graphs, we must remember that at the height of the pandemic, testing capacity was significantly lower and only a fraction of cases were being detected. Does Whitney think it's significant that deaths are nowhere near the levels they were in the spring? Deaths in France reached 153 on September 18th, compared with the peak of 1,437 on 15th of April. Right? So, interesting. Daily COVID deaths across UK and France and Spain. There we go. Is research on T-cell immunity being taken seriously? Sir Patrick said that fewer than 8% of the population has developed antibodies to the virus, and therefore the vast majority remains susceptible. It is true that studies to screen the population for antibodies have shown results in that 6 to 8% range. However, Sir Patrick did not reference research elsewhere which suggests that many more people may have gained some degree of immunity to the virus from their T-cells from previous exposure to the coronavirus. Covered here the other day, is he discounting the idea of mass T-cell immunity, and if so, why? I don't know much about T-cells. I'm just including that to be as robust as possible. 17 minutes? Unbelievable. I thought I was going to be short today. The NHS was not overwhelmed last time. Why is that a risk now? That's a good question. Chris Whitney spoke of the threat of the NHS being overwhelmed. The Nightingale hospitals remain virtually empty. Why does he think there's a serious risk of hospitals being overwhelmed? And why hasn't any data been made publicly available to discern capacity in the NHS hospitals? And why no lockdown death scenario? Chris Whitney spoke of deaths from 3 different causes: direct deaths from the virus itself, deaths as a result of the NHS being overwhelmed, and those from the NHS spending so much of its resources on treating COVID-19 patients that it was forced to reduce treatment for other conditions. What he didn't mention, however, was deaths caused by fear, people dying because they were too frightened to go to hospital or seek medical attention for heart attacks and the like. Recent data shows that the number of heart attacks detected and treated fell by 40% during the lockdown. Has a scenario for direct COVID-19 deaths. He has a scenario for direct COVID-19 deaths. Has any attempt been made to draw a scenario for deaths that would undoubtedly be caused by another lockdown? These are all questions, and they all apply to Canada, and particularly so when we've got the death numbers in Toronto looking flat, and the economic unbelievably bad economic turn that was caused by the lockdown and the government's response to this. And best of intentions, sure, but right, best of intentions, and the outcomes are catastrophic for many businesses, right, and many people, because the people are running the businesses, and if there's nobody spending any money, it's hard for a business to run that way. So these COVID-19 measures, these new lockdowns, John Tory being gung-ho on dropping the hammer, Doug Ford saying we're going to open up testing like you've never seen before, in the face of the doctors saying when you test populations low in COVID, you get 50% false positives. This is irresponsible at the very, very best, and much, much more insidious at the worst. So I hope that this is incompetence and not some kind of plan. I fear that I'm wrong. But I mean, if it's a plan, it's being rolled out in more than just Toronto, and more than just Guelph, and more than just the United Kingdom and France and Spain. And if the deaths are low across the world, and if the ICU admissions are low, and the cases continue to spike, is that going to be enough to cow people into submission? Is that going to be enough for John Tory to drop the hammer and tell you to comply? Is that enough? Is that enough? I was at my park last night across the way, and I was talking with parents, and COVID-19 numbers for killing children, right? Under 19, it killed one person, but the flu in 2018 killed like 34. And I said to my park friend parents, I said, I don't feel bad sending my kids to school during flu season, even though the flu kills 34 children under 19 in 2018. So that's just an average. I'm just using that as an average because I think I saw averaged, but whatever. Let's just say 34 for an average, right? Ballparking. Kills more than COVID. COVID killed one. So I don't feel bad about sending my kids to school about that. And I'm not concerned about them dying of flu. So why is this so much different, particularly in the face of these numbers? Why are our politicians ignoring all of this? How did I spend 20 minutes talking about this? All right, well, thank you for watching, everybody. I thought I was going to be focused and quick, maybe 12 minutes, I thought, but man, I talk a lot. Okay, links are in the description. Thanks for watching. Check out CanadaPoly.com. Check out CanadaReport.co. I may do another video today to actually get to the rest of the news. I have this whole other tab here. I'll show you just briefly because well, it's kind of fun. I have this whole other tab, right? Like Catherine McKenna wants to regulate media, right? It's crazy. It's crazy. There's all sorts of stuff. This is all the COVID stuff pulled out, right? There's a whole homeless thing that I'm going to do. Okay, we may get to it. We'll see. I've got lots of other stuff to do though, so we'll see. Thanks for watching, everybody. Have a wonderful, wonderful day.